even though that was going on during the day, I was using the Modia sleep at night and I was sleeping. It was remarkable to me that it could work that well, because that would have been a situation I would have taken some kind of
Mm.
medication.
Dr. Kennedy, thank you so much for joining us. For those who may not be familiar with your work, could you share a little bit about your background and really what inspired you to focus on sleep disorders?
Sure. I'm a clinical psychologist by training, and it's something I always wanted to do from a pretty young age. And when I was completing my training, I ended up at the VA hospital in Manhattan, loved it there, and they hired me to be the essentially the mental health liaison in primary care. And one of the first things they wanted me to do was to find a treatment program to address insomnia in the veteran population. So they gave me all kinds of time and space to do research and essentially train myself to become an expert in cognitive behavioral therapy for insomnia. And I designed and implemented a treatment program at multiple VA sites. And so that expertise was born for me. And then as time went on, I it would go out to cocktail parties and people would ask me what I do for a living, and I would talk about the sleep protocol, and people were really excited about it and always wanted to know how they could get it.
Mhm.
And so it just occurred to me that this was something that I could bring into the private sector and really, help people to develop healthy sleep skills and get off medications, because this was also at a time when um, sleep meds were really proliferating, and it seemed like everybody was on them. So we were trying to find a way to help people really treat the underlying condition of insomnia, versus just treating the symptom of sleeplessness, which is what most medications do.
Right, right. Thank you so much for sharing all of that. So you're the founder of NYC Sleep Doctor. You obviously are super experienced, over 20 years in practice. So can you just tell us a little bit more about your private practice and really just how it's evolved over the years?
Sure. Well, I started in 2008 when I was still at the VA, and I had a couple of small kids at the time and had really started to learn more about infant sleep and toddler sleep as well. So I decided to launch NYC Sleep Doctor as a practice that was focused both on helping new parents get their children's sleep on track and their own sleep on track, and then also focusing on working with adults one on one, as I was doing at the VA. And it evolved over time. I used to do home visits. I'd go into people's homes when they were in crisis with their children, and I was sort of a sleep fairy, and it was like nanny 911 for sleep, and it was wonderful and really rewarding. And I also gave a lot of lectures or seminars for expecting parents and new parents. And in one of those seminars, that there was an editor who came up to me afterwards and said she thought I should write a book about infant sleep. And so, long story short, we were able to collaborate and do that. And my book, The Good Sleeper, came out in 2015. And since all along since 2008, I've been also focusing on adult sleep, and that part of my practice has really just grown and grown, as people have started to really understand that long-term use of sleep medication isn't healthy, and they want to find better solutions to their sleep problems. So as that part of my practice has grown, and I started doing a lot more speaking engagements and consulting with brands that are in the sleep space, there was less and less time for the newborns and toddlers. So I decided a few years ago, to really focus on working with adults, and that's where I am now. And I recently also launched an online sleep school, which is designed to sort of improve access to the work that I do. So it's a self-help, self-paced video program that is based in cognitive behavioral therapy for insomnia, but it allows people to access it anywhere and affordably. So I'm really excited about that too.
That's great. So there's a lot of information out there about insomnia and sleep disorders. So can you explain to us the key differences between chronic insomnia and just those occasional sleep disorders that somebody may experience?
So, a sleep disorder is really something that is ongoing. Everyone has transient sleep disturbances. That's part of normal sleep. Our sleep is actually very sensitive to what's going on in our lives, sensitive to what's going on in our bodies, sensitive to the weather. I mean, it doesn't really, like anything can kind of intrude from time to time and give you an off night. And that's normal. And really, resilient sleepers understand that and kind of take it in stride. But what can happen is, if that's very distressing to someone, then they start to do things to compensate for those, what would normally be a transient sleep disturbance. They might try to make up for lost sleep. They might start taking medications. They might become very anxious. They might start doing a lot of research that only heightens their awareness and increases their performance anxiety. And then you have a more chronic condition that's occurring multiple nights a week, is maybe requiring medication, or is really disrupting someone's quality of life. So when you're in that situation, it's really important to try to get to the root of the problem. And by root of the problem, I mean what's going on with the sleep. You don't have to have a perfect stress-free life and have all of your ducks in a row to be able to sleep well. And so my role is really to come in and help people figure out what they can do within their situation to make some very key changes to their behavior and to their approach, to get their sleep on track. And then, in fact, once sleep is improving, you've got improvement in a lot of other aspects of life as well.
Right. That's interesting just to hear you speak about how these things that can be just normal stresses, but then they can turn into something that becomes a chronic issue. So, there's a lot of talk about sleep and how important it is, but what kind of impact does chronic insomnia have on our overall mental and physical health and well-being? What does that do to us?
Chronic insomnia and chronic sleep debt has affects essentially every system in your body. Like,
Mhm.
from your mental health, obviously, if you're not sleeping well, you're more irritable, you're more prone to depression, anxiety, and your mental health can kind of take a tumble. But insomnia and sleep debt also affect how our body's functioning physiologically, putting us at risk for metabolic disorders like diabetes, certainly weight gain. It even affects simply our food choices. We're more likely to go for unhealthy comfort foods when we're underslept than when we've slept well, which most people can identify with, I'm sure. Um, our bodies are repairing themselves. Our minds are flushing out the waste of the day and while we're sleeping, and so when you're not getting that sleep regularly, and I want to stress that because we're not again talking about those transient off nights, we're talking
Mhm.
about chronic sleep problems, then your health can be affected, cardiovascular risk factors, you name it. And it puts you at greater risk for colds and flu. Your immune function is suppressed. All kinds of scary, and really important risk factors are at play there. But the other thing that's really important to recognize is that when we start talking about all of these scary outcomes, people's anxiety goes way up about sleep. And then they start having a harder time sleeping because they're putting more pressure on themselves to get a
Right.
specific amount to be healthy, like it says in US News and World Report that they need to. And then I start getting a lot of calls. So
Yeah, so it just perpetuates the cycle, so to speak.
yeah.
So what are, we've talked about this in the past, but what are those common misconceptions that people may have about insomnia and the best ways to approach it?
First of all, I think that people really have a misunderstanding about how consistent sleep should be or how it's supposed to be. Like
Mhm.
people sleep differently, and your partner might fall asleep when their head hits the pillow, and it might take you 15, 20 minutes, and both of those situations is normal.
Mhm.
And it's also normal to have your sleep fluctuate, as I said before. I think it's really important to understand that normal sleep is actually a range.
Mhm.
Because when you have very specific categories of what is good sleep for you, then you fail a lot. And that increases your anxiety, and that beckons insomnia. Like it just opens the door to it. So
Sure.
really it's about that perfectionism that is kind of baked into our society these days, really
Yeah.
trying to open up the category of good enough.
Mhm.
I also think, other things that people tend to do wrong, they try to get 8 hours when maybe they don't need 8 hours. Not everyone needs, eight is not a magic number. Not
Mhm.
everyone needs 8 hours. And many people ruin perfectly fine sleep trying to reach this sort of magical number that is put out there in the media. And if you're trying to get more sleep than you need, then what ends up happening is it might work for a little while. Maybe, let's say it does work for a little while.
Mhm.
At some point, there's going to be a correction, and your body will say, I've got this surplus. And then you've got a correction of insomnia that
Yeah.
comes seemingly out of nowhere. And your sleep is fluctuating in duration night to night, and you lose that consistency that is much healthier. So you have
Hmm.
like 8 hour nights, and then you have a 5 hour night because you've accumulated too much.
That's really interesting. I wouldn't have thought that we could have too much sleep because, like you said, there's so much conversation around not getting enough that
Right.
that's really
Yeah.
interesting.
Everybody has their own set point, and it's important to kind of figure out what that is by keeping a consistent sleep schedule. Your body will tell you if you get up
Mhm.
at the same time every day, your body will start to tell you when it's time for you to go to bed at night, and that's a really good indication of how much sleep you need.
Right. So listening to your body is basically, something that we should all be really mindful and put at the forefront. So that's really
And
interesting.
and creating space for sleep. I think the other misconception is that sleep is somehow not productive time,
Mm,
and that's a big one that needs to change. And that's where those media articles are really helpful because they're letting people know that no, your body needs this, and in fact, it is, we expect a lot of ourselves. We work hard, we push hard, we try to, cram everything in. And then while we sleep, the body is recovering from all of that so that we can get up and do it the next day. So
mhm.
that if you think about sleep as productive time, the body is working, the brain is working. It's just doing something different than it does in the other, 18 hours of the day or
Right. That's a great perspective because you think like, oh, I need to be productive. I need to be doing all these things. And these high performers, somehow they manage to only sleep 4 or 5 hours a night. And it makes a lot of sense that there's restorative, processes that are happening and it is
Yeah.
productive to be sleeping. So um, let's shift over to one of the treatments that you offer is cognitive behavioral therapy or CBT. So Can you share a little bit about how that compares to, tell us a little bit about CBT and how that compares to other technologies and treatments that are available right now?
So CBT it is a broad treatment, and it focuses on identifying your thoughts and identifying behaviors, and making critical changes to how you're approaching things. CBTI is a specific form of CBT for insomnia. And
Okay.
so with CBTI, it's a short-term, very focused treatment where I do an in-depth diagnostic evaluation to really understand what's going on, what are the triggers of this, what are the factors that are keeping the problem in place, and methodically go through making a series of changes to a person's routines, to their schedule, to what they do when they can't sleep. And then as they start to get some traction, as the body starts to understand that it's being given the conditions it needs to get back into a normal sleep rhythm, then we start to work on the anxiety and the thoughts that lead someone astray or heighten their arousal level. And all of that together is usually about 4 to 6 sessions. It's pretty remarkable,
Wow.
because it when you make these targeted changes, they work really quickly because the body wants to sleep. And,
Hmm.
and people just do the wrong things out of desperation. And when you correct that, and with guidance to stick with something that might feel hard or even uncomfortable at first, if you stick with it long enough, and long enough might just be a week of doing something, then the body, it's so happy to help you out and get back into the rhythm that it wants to be in, because sleep is really, it's really an automatic process. It's like digestion. It has a rhythm of its own, and it doesn't really need a lot of intervention. It really needs us to take care of it and give it the right conditions. And when we do that, it rewards us.
So what are some of those recommendations that you would tell patients that are just looking to improve their sleep quality?
So, first and foremost is get up at the same time every day. And that is, people often sort of shrug at that because that's not about sleep, but it is about sleep. When you wake up at the same time every day, you set your body clock, and then your body starts to understand when it needs to sleep at night. And it creates sleep pressure throughout the day that builds up to a point eventually where you have to sleep. Um,
Hmm.
and so that consistency is what your body wants for sure. Then there's, the question of your bedtime. Now, if you Google, what should I do, it would say go to bed at the same time every night, which is
Right.
not exactly true. If you go to bed at the same time every night and you're not sleepy, you're likely to have insomnia, and it will take you longer to fall asleep than if you waited until you were very tired.
Hmm.
So you essentially will set an earliest bedtime based on your wake up time. So if you're a person who needs 7 hours, that and you're getting up at 6, your earliest bedtime would be 10:30. And but you don't go to bed until you feel ready. And eventually that kind of evens out, and it becomes a rhythm. And then there's the sort of taking care of your mind part of this, where, we really um, have very overstimulating days these days. We have information coming at us from all directions. We multitask. We're texting with family and friends while we're working. We're, scrolling our phones while we're watching TV. Where, there's news, there's fun, there's all games, there's everything. And the brain is just very, very active. And we it didn't used to be this way, you know, like
Right.
this is relatively new, and our brain has not evolved to be able to switch off immediately after turning out the lights if we're putting all this information and stimulation in right up to lights out time. So it's really important to give yourself a buffer and allow a wind down time. Like I think of it as an off ramp from the day. The day is very much like a highway, you know, you're speeding down the highway and you can't just hit the brakes and dive into bed and expect to sleep. So you
Mhm.
need that time to decelerate and settle down, let your brain sort of process the day, and then you go to sleep.
Mhm.
That's really important.
That makes a lot of sense. You think about just all that stimulation that we get throughout the day and then trying to just, switch it off right away. It's not realistic, and it's
Yeah.
not a realistic expectation of ourselves to be able to do that. So
Yeah.
moving on to new technologies, with
Yeah.
the launch of Modius Sleep, which is non-invasive, non-drug option, what kind of role do you think that's going to play in treating chronic insomnia?
I'm really excited about it. I am, of course, a devotee of behavioral change and taking care of your sleep and with the sort of CBTI techniques. But there's always a place for this physiological component. The and what the Modius sleep is doing is really filling a gap is that I think is really really important. And I've used this kind of technology in the past. This is much more advanced, and which makes me even more excited about it. Um, but you know, it really is is a helpful tool to to do that sort of settling of the brain, to help bring that arousal level, that stimulation level, uh, down to something where the body is ready and excited about sleep. And I think that that's really incredible. And also just in terms of improving sleep quality,
Mhm.
because there's so much that you know we can control, and there's so much we can't control about our what is affecting our sleep quality. You can do everything right and still have, feel like your sleep isn't as restorative as you want it or need it to be. And that can be chronic, that can, or it could be based on circumstances. Maybe you're going through a super stressful time. Maybe you're having a lot of hormonal changes as a woman at any point of life, whether it's you know PMS or perimenopause. Like those kinds of things have a real physical impact, and there's only so much um, that CBTI can do in that situation. So I
Mhm.
see them really as very as partners, and I think that because it is always important to do to follow the right behaviors. You can't
Sure.
just live your life speeding down the highway and then use something to knock out and expect that to work all the time. Like it might work sometimes. People use medications that way and they can work, but the that's not a sustainable solution. So I think that with the Modius sleep and understanding how to take care of your sleep um, with your own habits and routines, I think that that is a really exciting combination.
Mhm. So you mentioned sleep medications. How do you think Modius Sleep falls in the treatment algorithm? Is it something that you would consider first line ahead of putting somebody on Ambien or some sort of sleep medication? Kind of how do you see that fitting in?
Well, first of all, I don't prescribe because I'm a psychologist and not an MD. And so, but I do have opinions about, what people can do and should do in a pinch. Like I'm not opposed to sleep medications in certain circumstances if something is acute and it really it can be very helpful. I see Modia sleep in that realm as well. And I think that what's better about it is that you don't really have to be struggling to benefit from it. Like
Mhm.
it helps regardless. And so in a, it's sort of a lower bar to suggest this to somebody because they don't have to be in a crisis to benefit.
Mhm.
So,
Right.
I, I can say for myself, I've been testing it, and I was going through a pretty extreme set of circumstances a couple of weeks ago, and was very, very like elevated in my arousal level and in sort of fight or flight mode, dealing with something unusual. And even though that was going on during the day, I was using the Modia sleep at night and I was sleeping. It was remarkable to me that it could work that well, because that would have been a situation I would have taken some kind of
Mm.
medication to ensure I could sleep, to just keep going through this sort of crisis situation.
Right.
Um, and so that was really encouraging to me, especially because medications have side effects
Mhm.
and they can be addictive. Even if they're not physically addictive, they can be psychologically addictive. People very often get caught in a rut of, lying there thinking, am I going to have to take it tonight? I don't want to. Is it, how long do I have to wait to see if I need it? But then I have to take it before this time, otherwise I'll be hungover tomorrow. And then all of
Right.
that just causes the insomnia. So
Sure.
so here you have something that is non-invasive and you don't have any of those concerns. And I think it's really a spectacular addition to what we have available. And I do think I think we're going to see as time goes on that it's going to occupy a bigger place.
Yeah, that's a really important point about, when you take those sleep medications, you don't know what's going to be the aftermath and what side effects are going to bring, or you hear crazy stories about Ambien and people waking up in the middle of the night doing crazy things that they don't remember.
Yeah,
So,
emptying the refrigerator, driving, smoking, like it can be dangerous.
right.
And that's I do really, and a lot of people don't want to take medication too. Like they really are craving a solution that doesn't make them feel vulnerable that way.
Right.
And I think that there's the Modius sleep feels like a positive thing to do. It feels like a healthy activity, like a supplement or something, that's gonna contribute to your health. Whereas sleeping pills often feel like a dirty secret, like, and they're sort of a weird compromise where, you need it, but or you think you need it, but it comes with a lot of baggage and it feels like it's not ideal. And it's not. So,
Right.
yeah.
Right. Well, while we're on the technology topic, I'm curious to get your thoughts on, there's so many sleep tracking devices out there,
Yeah.
monitors, all of that. What's your take on tracking your sleep and all of that technology?
Well, I see a lot of people who develop anxiety because of the trackers. And they can be helpful in giving you a better understanding of what your habits are. If you're really not making enough time for sleep, and you want to try to make some targeted changes there, it's obviously helpful to know what your baseline is and what you're actually doing.
Mhm.
However, you can do that yourself. Like you can keep a spreadsheet and write down what time you're waking up every day and what time you think you're falling asleep. And because what the trackers come with is also a set of ratings about how well you've done at sleep, and how ready you are for the day, and it tells you things like, you know how much delta wave sleep and how much REM sleep you're getting. And all it might be nice to know that, but it's also frustrating because these aren't things that we have the kind of control over that
Mhm.
we would like to. And so you're getting information about something that's not necessarily up to snuff in what your body's doing. And
Mhm.
maybe there are things you can do about it. Like maybe you can cut back on coffee, or there's obviously things that one can do, but again, you can do everything right and still not get a perfect ratio of REM
Mhm.
sleep to whatever. And so those become sources of anxiety. And and also you're getting a lot of information without sort of a layperson's explanation of what it means. And that is something I often have to work on undoing with people I work with. So I think it's great to track your sleep. I personally use a very rudimentary sleep diary with my patients because I want to know what they think is happening more than what a tracker is telling them is happening.
Mhm.
Because for my purposes, how you feel about sleep is what creates the anxiety that that triggers insomnia. So
Right.
it's enough to just get people's impressions. And those sleep trackers, they don't treat anything. Like they're not fixing a
Right.
problem. They're giving you information that may or may not be helpful to you. And but they're not an intervention. And so
Mhm.
that's important to understand that this, it's really not it's not the same thing as what we're talking about with the Modius sleep.
Right. No, that makes a lot of sense. And it almost seems like there's a little bit of judgment and how the person's going to interpret the information. But to your point, you're right. It's not treating anything. It's just data really that could be
Mhm.
useful, not useful. So what would you say are the common barriers that really prevent people from improving their sleep? Is it, lack of effort, commitment, or what are the barriers that prevent that from happening for people?
I think um I think people don't fully understand the basic things they're doing during the day that are undermining their sleep.
Mhm.
And so I think that there are a lot of myths and misconceptions around sleep that don't get corrected. And we've talked about some of them. And so that's number one. I think the idea that sleep isn't valued as much as active, productive, maybe money making time during the
Mhm.
day, like that. It isn't viewed as essential by a lot of people, not everyone. But it's deprioritized, I would say.
Mhm.
I think that technology in our society is a big barrier because it's really taken away the boundaries between work and home life. And it's taken away that um, sort of enforced wind down that people used
Sure.
to have um, because because there's work, because there's so much content. It used to
Mhm.
be like if something was boring on TV, you just turned it off, and now
Great point.
yeah, there's always something else. So, and then when it comes to treatment, what I do is still kind of hard to find, and it can be expensive. And so there's a real access and affordability aspect to getting the treatment um,
Mhm.
to really treat the underlying issues with insomnia. And that's the other reason that people are so quick to go to medication because it's sort of it's easy and you can get it. So
Mhm.
with something like this, with the Modius sleep, it it fills that gap as well.
Mhm.
And and not everyone needs full on therapy, CBTI for their sleep issues.
Yeah.
I think that it's important to back up the the benefit of the Modi Asleep with information about how to maximize or how to take care of your sleep with good habits, um, so that people aren't sort of fooled into thinking that their fantasy of just like, okay, this is going to fix it, I don't have to change anything else, you know.
Right. Right. Not just
And
a one.
it
Yeah.
will, to a certain extent, it will, but to sustain the benefit,
Hmm.
it's part of a lifestyle.
Sure. 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 So you mentioned, talking about working with new moms, new parents.
Mhm.
So you've spent a lot of time on postpartum, working with postpartum
Yeah,
women. Um, how does chronic insomnia impact new mothers, and
it's
how
debilitating.
sure, right.
Yeah. Yeah, chronic insomnia is debilitating to new mothers, and it puts them at risk for um, postpartum depression and anxiety,
Mhm.
and other mood disorders, or even, in very extreme cases, postpartum psychosis, which we're hearing about too. Um,
Right.
so, and also, new mothers are often very reluctant to take medication if they're breastfeeding, and so they kind of put their needs last,
Mm,
and in service of keeping the baby alive and
right.
adjusting to motherhood. And it really it can have a profound and long lasting effect, because that that disruption, eh, that starts with insomnia, it makes them feel desperate. They're not feeling like they're getting what they want out of their, whether it's their maternity leave or beyond. And it can interfere with bonding with the baby, can cause problems in marriages, you name it. And it just makes, women are very vulnerable, emotionally after having a baby, and it just compounds it. So this, I think that's a great way to intervene, is to use something like the Modi Sleep, because it 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 doesn't come with all that other baggage, and it works really
Right.
quickly.
Right. Yeah, that is true. I remember being a new mom, and just the stress of all that and not sleeping, and then the pressure of knowing that, you only had so many weeks and then it was back to work. So Modi sleep would have been very helpful back in those days.
Yeah, and then you're back to work, and my goodness,
Right.
like trying to get the sleep you need to do that. It's like
Right.
it's very, very intense, and not to mention, or the hormonal aspect of it, because
Right.
that postpartum period, and then the period, if you're breastfeeding, when you wean your child, your hormones are going bonkers, and
Mm,
that has a true effect on sleep. It's not psychosomatic. Like, this isn't somebody
mhm,
just being nervous. This is a physiological um, phenomenon that is real and can be debilitating. Many women have mild insomnia. Many women have very severe insomnia, related to hormonal shifts in this period, and it can be dangerous to, certainly to mental health, but also physical health too.
mhm. So you mentioned hormonal changes, and that just made me think we get a lot of questions from women about that are going through menopause,
Mhm.
perimenopause, and what we hear pretty consistently is this waking up, this 3 a.m. wake up.
Yeah.
So how do you think Modi Sleep could potentially, help with that? Or, is there a role for Modi Sleep in menopausal women that are really struggling with this middle of the night wake up, and they just, are having really, difficult time sleeping through the night?
I think there's a huge role for it. And I think that anything that can help women in that time of life is a godsend, because every woman is different in how those hormonal changes manifest. But the night waking is a very, very common disturbance, and it is debilitating. Like, because it it is chronic. I mean, and because it's hormonal, that waking is very forceful,
Mm,
and and then it starts to trigger anxiety and, frustration, and then that keeps you awake longer.
mm,
So, I do think that the Modius sleep is an amazing gift to women of a certain age, and I, as part of a broader plan to address the all of the health implications and needs at that time, because you want to think about whether hormone replacement is appropriate, all kinds of things. But this as a tool, I think is brilliant, and I see a lot of women in this age range, um, and there's a desperation, and it's really, um, you know, the behavioral part can only go so far when your hormones are kind of betraying you.
mhm.
So there's a lot I can do, but having a tool that really addresses the um chemistry of it, the neurochemistry of it, like that's really amazing. And I'm very happy to have that to offer.
Yes, we're excited too. I think it's going to help a lot of women that are going through that time period. So, I think with new technologies, there's a lot of excitement in sleep science. So, where do you kind of see the field heading in the next 5 to 10 years? What's the future look like for sleep medicine?
I think it's really exciting. And, I'm hoping that there will be more and better treatment opportunities for things like sleep apnea, that are more comfortable than what's available now, and
Sure.
more likely for people will be more likely to comply and use them regularly, because that's a big issue.
Mhm.
I think that, the neurostimulation technology is really, really exciting and super important. So I'm very excited about that, and I'm hoping that the technology really usurps the pharmacology of it, because it it should, it's healthier, it's safer, and it's really correcting something that versus just masking, and that is huge. And then there's all kinds of other technology, temperature management, and those kinds of things that I think are all welcome as well, because as we think about the things that improve sleep quality, there are a lot of opportunities to enhance what you know what we can do, just without all that tech.
Right, right. Well, this has been extremely beneficial. Just to kind of wrap things up, what are three things that our audience can do tonight to improve their chances of a good night's sleep? So what are three main key takeaways for our viewers?
I would say turn off your tech, at least an hour before bed, and I always tell people to stop work, much before that, but really, like, stop scrolling, stop texting, all of that at least an hour before bed, to give your brain that cool down time. Um, I always recommend reading a book. You can read on an e-reader as well. That's fine, but not on your phone, because you're too tempted to, check your text or your bank balance, if you're on your phone. And because reading before bed does a really good job of clearing out your brain, giving your brain a chance to settle down, because you're really escaping your own stuff and getting into some other drama that's not yours. And that signals to the brain that it's okay to relax, that you're safe, and you can let go. And what else? A third thing, I would say, putting a cold pack on your forehead before you go to bed for about 10 minutes, is a really great way to slow down racing thoughts. And it also helps to lower your core body temperature, which is a signal to your body to sleep. So,
Great. Well, thank
yeah,
you so much. I
mhm,
hadn't heard the cold pack. I'm going to try that and
it's
see how that
great. Yeah.
All right, Dr. Kennedy, thank you so much for all the information. We appreciate your time.
Thank
And if
you.
somebody's looking to meet with you or get more information, where can they find you online?
nycsleepdoctor.com.
Wonderful. Awesome. Thank you so much.
All right. Thank you. Take care.